Welcome back. With the move into the red tier and the potential disbanding of the tier system, we're being told possibly altogether, there are many questions surrounding what the future in Kern County will look like. And joining us this morning is Public Health Director Bryn Kerrigan. Bryn, thank you for being here. We appreciate it.
Thank you for having me.
You know, what seemed like such a long time for Kern County struggling in the purple tier, we not only moved into the red, but now are on the verge of even going into the orange. Is this something that you were expecting, or the models were kind of forecasting for a while once we reached this point of the spring?
So the models early on did forecast that we would reach our high point of the surge in late January, which is exactly what we saw. However, we saw 2 surges and the model only showed 1. So we didn't really know what the future was going to bring for us when we were in the midst of that second surge, but we're so excited to be where we're at right now.
Talking about moving into that red tier right now, so many people have been waiting for this opportunity out there. Vaccinations are moving along as scheduled, and I'd like to touch on that real quick. It seemed like there was an initial surge of people getting vaccinated, but jumping on different websites, we see a lot of openings out there. Now, what is the reason for that? Is it because the people in the tiers are slowing down to go get vaccinated, or the accessibility is a problem?
So I believe that there's a lot more providers on My Turn. So we're able to see that there's a lot more available appointments, where before we didn't have that visibility into the system to see actually where providers were and what appointments were available. So that visibility is helping us see that we have a lot more capacity in our county to vaccinate more people. I also believe that people think that the vaccine is going to be here, that they have an opportunity to get it, so they're not having some sort of sense of urgency to go get vaccinated. I'd like to encourage them otherwise, because shortly the state will open up more eligible groups, and that supply may not be there for them to get the vaccine when it's most convenient for them.
You know, during your address before the Board of Supervisors yesterday morning, you also talked about projections as how long it would take to get everybody in those different categories vaccinated. I mean, we're talking dozens upon dozens of more weeks in order to get that done. Is there anything, I mean, you obviously can't take people to the sites to get them vaccinated, but is there anything else the county is exploring about ways to speed it up?
Absolutely. We're exploring mobile options so that we're bringing the vaccines into these neighborhoods to make it easier for our community to get vaccinated. Some people may have transportation barriers. We've implemented a transportation service so that individuals can call and they can get transported to and from vaccination sites. So we're trying to make it as easy as possible for our community to access that vaccination.
You know, we're talking about the red tier possibly moving into the orange by April 7th. That is when we're going to be coming out of spring break. Is the health department throwing any cautionary out there? Because we've already seen in different states where spring break has happened, there's been a slight surge.
Absolutely. Any type of holiday does bring some sort of fear to us. So we try to continue to do our exact same messaging, which is, you know, distance, mask, wash your hands often, avoid gatherings. So if you do want to travel on spring break, we encourage you to do that with your household members and to keep your distance and to continue to use those COVID mitigation measures so that we're not seeing increased transmission of the disease.
I know that you were just mentioning that you get a lot of direction on where to go and what to do from the state as far as their guidelines go. We have seen other states where a surge has happened. They maybe shut down a little bit or not at all, rode out the surge, and then carried on. Is that something that's more likely this time around? Should we see a surge that we might, or will Kern County be under the threat of falling back into the purple tier again?
So that's really the threat that we would see, is that we would fall back into the purple tier, and that would be truly unfortunate for us to see. We're so close to that orange tier. We want to continue in that direction. Kern County has never been in the orange tier, and it would be so exciting for us to see not only our economy be boosted by being able to be in the orange tier, but the hope that the disease is really on the downward trend and that we can get a hold of it and get back to our normal lives.
Bryn Kerrigan, Public Director of Health for Kern County. We appreciate your time this morning, and best of luck moving forward. We look forward to you joining us again in the near future.
Thank you.